I want to thank you for the opportunity to come and speak with you about Caregivers Alberta and what we do throughout the province to support our family caregivers in communities throughout the province. Events like this are so important to our organization because it's a conduit to connect us to caregivers so that they know where to turn for support. So why do caregivers matter? There are over 1 million caregivers, family caregivers in Alberta, who for all intents and purposes are part of the healthcare labor force. Family caregivers keep our healthcare system going. When I'm in meetings with physicians and other people, other healthcare professionals, they tell me that Alberta Health Services has a workforce of over 1 million strong who are not on the official payroll. They are the shadow workforce. Our family caregivers are doing heavy lifting to ensure that their loved ones have the support that they need so they can stay at home. Our family caregivers are doing essential healthcare related services, and they are often untrained, and they are often unpaid. So they are part of the unofficial workforce, but for those two things. They're unpaid and they're not adequately trained. They're caring for somebody at home, their loved one who is living with cancer, living with dementia, Parkinson's, MS, heart disease, stroke, and often with inadequate training to do so. A loved one might be discharged from hospital. The caregiver is told somebody from home care will be around to show you how to remove that colostomy bag, and often home care doesn't show up and you're left on your own to do that. So our caregivers are also supporting their loved ones to age in place, and that is important because we know that that's where most people want to age, in their home. And it's important for quality of life, and it also makes sense to the government economically. We don't have enough beds in the continuing care system, nor do we have enough trained staff to provide care for people who have to transition from home to the continuing care system. And finally, caregivers matter because their health is at risk. Caregivers are often referred to as the invisible patient. They are taking their care recipient to appointments, and they're in the doctor's office, and there's no time for the doctor to ask how the caregiver's doing. There's no billing code for it. And it's not the doctor's fault. You can only do so much in 10 or 15 minutes. So the caregiver is often unacknowledged. One doctor told me that, we're discouraged from asking the caregiver, how are you doing? Because we don't have any, if they tell us how they're doing, what are we going to do for them? What do we have to give them? Then we're accountable. And so these are the systemic problems that we're trying to face and find solutions to when we work with our partners in healthcare. When I joined Caregivers Alberta a little over a year ago, the first thing I did was have a series of roundtables because I wanted to hear from caregivers about what a day in the life looked like. And it became apparent to me that there is a number of caregivers who are in a state of trauma. And I don't mean that in a medical sense because I'm not a doctor, but if you think of fight, flight, or freeze, it was easily recognizable that they are in a state of freeze. There's fight or flight is not an option, and they're in a state of shutdown and not able to do anything. And when you're at a 9 or 10 out of your state of overwhelm, and your caregiving duties and your job is done at the end of the day, the last thing you want to do is do something to connect or join a support group. You just want to relax and chill for a while for most people. So this slide is extremely important to me because it demonstrates that we need to connect with caregivers further upstream in the journey before they're at 8 or 9 out of 10. And just to give you a little sense of the spectrum of where people can be at in their caregiving journey. So for me, as a caregiver to my aunt, I'm picking up medication, taking her to appointments, shoveling the snow, even just taking her out for a drive seems to be a big deal. But I had a conversation with somebody a little while ago. her and her sister. The sister is doing most of the caregiving duties for the father, and the sister, that sister told her sister, you know, if I don't have some sort of intervention here, get some support, I feel like I'm going to hurt him. And so I just want you to be aware of the spectrum of where people are at in their emotional distress and the support that they need. Most of the caregiving in community is done by the family caregiver. There's also caregiving done by paid caregivers, personal support workers, healthcare aides, but 80% of it is done by the family caregiver. Alberta Health says that of care, that 51% of care currently takes place in community, 49% in facilities. They want to move that community-based number from 51 to 70. And that's not a bad thing. They want more people staying at home. It makes good sense for quality of life, and it makes sense economically. We just need to make sure that our caregivers are trained and supported to be able to do that. The impact on the economy. The University of Alberta in 2018, using the General Social Service Census, found out that in Alberta, 647 million hours of unpaid care are what our caregivers are providing each year in our province, translating to about $12 billion to the economy annually if you were to have to replace what the family caregiver does with the professional paid workforce. So who are our caregivers and what are they doing? Well, they're parents taking care of children with a disability. They're adult children taking care of parents. They're a spouse taking care of someone with a disability or illness. And they're also a friend or family taking care of someone who they're not even related to. Breaking it down a little bit more, we know that caregiving is split pretty much 50-50 between men and women. But we also know that the more complex the caregiving duties are, the healthcare responsibilities that they have at home, those are more often done by the woman in the house. About half are working full-time, and most of them, 63%, are in their prime earning years. So we need to take care of our employed caregivers because we don't want them leaving the workforce, and that happens sometimes. So caregiving can have an effect on their quality of life. It's affecting their retirement, affecting their ability to do the things that most of us take for granted. 1 in 5 caregivers are under 30, and 17% are seniors. And if you're a senior taking care of your spouse and you haven't been trained on how to transfer somebody, you might put out your back. So there's some real health issues that are potentially affecting caregivers. We know that nearly half of our caregivers are caring for a parent. 1 in 10 care for a child, 12% care for a spouse or partner, 4% for a sibling, and 16% aren't related to their care recipient. So I just want to go over some of the services that caregivers can expect to receive when they contact our organization. So it begins with our intake, our support line, where through phone or email you would get connected with Munit, who triages any requests that come in, and it might at that point be simply connecting someone to resources. If somebody needs more intensive support, they will get scheduled with a caregiver coach. We have about 10 caregiver coaches, full-time and part-time, around the province who work virtually, and so somebody can have scheduled time with a coach. We provide a number of education sessions on various topics affecting caregivers, from, say, having an expert on transition services. So if you need to transition your loved one from home to continuing care, we have experts who can provide counsel around that because it is complex. Self-managed care is complex. Even child caregiving tax benefits. So tax implications. So we'll provide a number of education opportunities related to caregivers. Caregiver support community, those are our peer support groups. We have a number of virtual peer support groups that take place different days of the week and different times of the day to try and accommodate different schedules. And those are all virtual now. We do want to get those back into community in person, maintaining our virtual ones, but also creating in-person support groups in communities throughout the province. If anybody is interested in becoming a trained peer support group facilitator, either virtually or in person, reach out to me. One of our best, most effective programs that we have, Compass for the Caregiver, it's been around a long time, and people just absolutely praise this program after having participated in it. It's a 4-week, 4-module program. And finally, system navigation. I was very proud that we just added a member of our support team, system navigator, who's able to, in addition to the coaches, drill down into helping people navigate a very complex healthcare system. And we also are a partner with government. Government understands the importance of caregivers to the economy, to quality of life. And so we are a trusted partner, a thought leader, and work with them to bring ideas to the table. For example, one of our priorities is respite. We need to figure out how to give caregivers a break from their isolation, their mental fatigue, and we need to bring ideas to government so that we can create action plans around that. This is what the Compass for the Caregiver looks like. It's a 4-week workshop, as I said. Being a caregiver, many caregivers, the first step is identifying yourself as a caregiver. We often say that if you don't know that you're a caregiver, you're not going to reach out for support. So that's step one. Managing your stress, balancing your relationships, and navigating the complex healthcare system. And we recently ran a pilot. Over the last year, we've been working on digitizing this program. So it's now available online in a self-paced format. So people can go on, register for it, and take it at their leisure. This is the only program that there is a fee for. All the other programs are free. Only one of the reasons is because this is in such high demand that if we find that if people don't pay for it, they don't show up, right? There's a big high attrition rate. So yeah, you probably know that, right? And so yeah, people are more accountable to it if they paid a small amount. But we never let fee be a barrier, right? So we have like a scholarship, and if somebody can't pay, that's no problem. Yeah, our peer support group, just a little more detail on that. The coaching, free caregiver coaching. All of our coaches have a social work or psychology background, one-on-one listening ear, navigating the system, referral to resources and support. And yeah, it's just, the emotional well-being and the mental well-being of caregivers that we're trying to address. Supporting care in community. So there are a few initiatives that we have that are helping to enable support in community. One is the ambassador program that I am very, very excited about. My colleague here, Carol, is leading our ambassador program. Just a little bit a backstory. Before coming to Caregivers Alberta, I was with MS Canada for 15 years, and we created an ambassador program here in Alberta, which was emulated right across the country. And so when I came to Caregivers Alberta, I knew I wanted to create and found this wonderful person who's just like over the top. And so our ambassador program is really about expanding, leveraging our capacity. So especially in rural Alberta. So we will train ambassadors, I think I've got a slide here, to do a number of things that align our strategic priorities with their talents and interests. So one-on-one, just letting people know who we are, recognizing a caregiver in your community, making a connection. Making a connection with a facility in your community, a seniors residence. Hey, can Caregivers Alberta come in and do a presentation to your staff, to the caregivers who come into your residence, to your library, whatever the case may be. Sharing stories. I'm a big proponent of storytelling. So if we need to get caregivers as ambassadors sharing their story. And if they're interested in government relations, let's get them doing some advocacy work. We will train ambassadors how to do government relations 101, and they can connect with their local MLA in their community, in their riding. A big initiative that we've been working on over the last year, supporting working caregivers. This is a program in partnership with our research partners at the University of Alberta, McMaster University. We have an advisory committee consisting of HR professionals from around the province. The worst case scenario is an employee who has pretty complex caregiving responsibilities at home and doesn't have the support at work, doesn't have a flexible working arrangement, doesn't have accommodations, leaves their job, calls us, says, I left my job, what sort of income supports do I have? Well, I hate to tell you, there's nothing. That was a bad decision. So that is one of the things that we do through education and creating these caregiver-friendly workplaces. We did a presentation to RBC in Calgary last week or the week before. We're going down to Calgary again to do a presentation to the Federal Energy Regulator. We're speaking at a conference tomorrow about this. So it's sort of a next large, significant area for us that we want to make an impact in. Employed caregivers face reduced job security, reduced work-life balance, and delayed career advancement. This is a slide about Andrew. Andrew's a PhD candidate from the University of Alberta who's leading this project for us. So what can you do? As I said, keep your ear to the ground, keep your eyes open, and if you see a caregiver, let them know who we are and what we can do. That's it. Any questions? I'd be happy to take them. Yeah.